Hello and welcome to Golden Eyes Beauty and Aesthetics. My name is Catherine, and for those of you who don't know, it's Friday, which means it's Fact Friday. For those of you who do know, welcome to the next part. So last time we spoke about Botulism, and this lady was on speaking very similar about it. She was talking about botulism, which I think we mentioned and we touched on our Botulism video, which was caused by an illegal fake product being used on clients. And unfortunately it causes damage to the nerves in the face, which then has meant that some people can't close their eyes, they can't see properly, things like that, and that's where the botulism comes from. Now this lady was saying and giving us the impression that only going to a medic is the only safe way of avoiding botulism, and that's not true. You can go to a non-medic as long as they have a prescriber, they're insured for it, and they're using a reputable pharmacy, and it is in a clinical setting, so it's about going to someone with good ethics when we're going to someone to have our face injected with these treatments. They shouldn't be costing £60, which I've seen before. I've seen fully qualified practitioners say, just charge it as model prices for now, but £60. And then they go, it's a limited time, it's only one time offer. And then if you look back through the profile, you've gone right the way back through and it's been £60 the whole time. That's because they're buying it from somewhere illegal and using aesthetic wholesale, which sells Botox toxins for about £25, which is one that I saw, which is absolutely ridiculous. And that's brands like Botulism, Venotox, Innotox, Mesotox. I seen one the other day, something like Neurontox or something like that. They come up with all sorts because they think that the consumers don't know, and a lot of the time, yeah, they don't know. But what you should be able to do is speak to your practitioner and say to them, can I see, do I need to see a prescriber? Their first answer should be yes. If they say no, it's okay, you can come in and see me, or the one thing I will say is that as a medic who has got a prescribing qualification, if you are going to like a nurse with a prescriber's qualification, they will say to you, no, you're not right to come in and see me, but check with them first, check that they are a nurse if that's the case. If they're not, and they're not a nurse or they've not got a prescriber, you should be able to say to them, can I have a look at my vial? And they'll pull it out, and on the box on the front it'll have a prescription with your name on it. Like when you go to doctors and you get your antibiotics and you've got one of them sticky labels on the front, that'll have your name on it, and that's how you know then it's legit, it's come from a legit pharmacy. There are certain aesthetic pharmacies that we use so that we can get these, and they have to go through the prescription process, and that's when it's safe and legal to use. What I think a lot of the time is that people think that non-medics are just these people that know nothing about the world, and while there are some that have gone on access to pathways and may not have a full understanding of anatomy and physiology, I think it's very hard to tarnish all of us with the same brush when there are people like myself who, just to go and do massage, I had to for my level 3 massage, I had to know the whole anatomy and physiology of the whole body. When we do facials, we have to know about the anatomy and physiology of the face. There's a lot of it that we have to know and we have to learn just to be able to pass our level 3, and then to be able to pass our level 4, and so on and so forth. And the more that you go through your levels, the more anatomy and physiology that you know, and you may learn at a more greater depth. But even then, being honest, I look at my level 4 and what I learned through that from anatomy and physiology, and there is literally so much, and it's so in depth, it takes so long to actually complete the work. So as a non-medic, to hear that like what we've learned isn't good enough for people to come to us and get the treatments done actually really hurts, because I've been sat on training with medics and non-medics and learned exactly the same thing. Does it mean that my training and my knowledge from that course is any different to theirs? No, we all learned the exact same thing. what it matters is the ethics of that person. So making sure that you have a prescriber, you have insurance, making sure that you can see the prescription, making sure that you can ask them what the pharmacy is that they've used to get the product. Check all of that out before letting someone come near your face with a needle. And that's what it's all down to, and it's down to the ethics of that actual practitioner. That's it, guys. There are good medics, there are bad medics, there are good non-medics, there are bad non-medics. Be wise and choose correctly, and ask. You have a right to ask. You're paying this amount of money for the treatment. You have every right to ask. Just ask. Okay? And I will see you all soon. Bye.